Hey, it's Melanie Petro, and we have somebody who is going to show y'all what we're doing. So tell them what bugs you.
Scared?
Pressure. Well, what I see, sit up for me. Can you sit up a little bit? Like, so she's got this shadow that right through here. And then over here. So sometimes it takes multiple views. Like from here, you can see it even better, and it's flatter on this side than this side. She's got one brow that's a little bit higher. I like her hair color. And so we need to add some volume right through here so that she doesn't look as dark. And you notice it when you turn from side to side and you see this, it really comes up as a shadow. VZ has it too.
I've got my stuff.
VZ got caught up in filming for a show we're doing, so I got to draw on her. But you can, I really didn't notice it till I saw her. Usually just looking to see what's in her hand and what she might have brought me. But were you excited or nervous?
Both.
That's a good answer. So when I look at your face, I just see the darkness. I don't think, gosh, she needs filler under her eyes, and I think that's important because that's not what I think. I just think this looks dark, and it looks dark over here, and it looks dark over here. This brow is a little higher, so being very, very careful with Botox because that could cause issues up here because this one's going to arch up at an angle, and that's just her natural brow. But if you don't pay attention to those kind of things, then you can create a situation where it looks worse. She's got, this eye is a little bit lower than this one, so it makes this one a little bit darker. A little bit of her nose kind of goes this way, so she kind of shifts off to the side. And she's got a very pretty face. I'm just picking it apart. You have near perfect skin. So you're going to look lighter under your eyes. Is that what you're hoping for, or is that just what I want to do? Will that make, we like that? Have you noticed it looks dark? Do your pseudo friends say you look tired?
Yeah, I don't like it.
People tell you look tired?
Yeah, I've been noticing it lately.
Now, a lot of people do people laying down. I bet it's a lot more comfortable, but it also, it's not the same. Unless you're going to lay down every time you meet somebody. So I'm going to let you sit, you got to sit up for me. Like, I don't know. And then the other thing is eyes closed. So open, like, now close your eye. Close it tight. You see how this moves? So you just have to be really, pay attention to what you're doing. I would never do it with her eyes closed. Maybe 10 years ago. Not now. Okay, open your eyes for me. Can you do that? Don't look up. Y'all, let me show you why.
It's for, I think it's for the alcohol.
Okay. Now look straight. Even when she looks up, it moves this. Can you stay like that? You okay? It'll stay. Doing everything I can to avoid a bruise.
Someone asked, what are you using?
I use Volbella. I won't put anything else under the eye. It's a thin product. It moves with her. It doesn't create blobs, for lack of a better word. And I've used everything. So holding pressure when you think you might get a bruise is what stops that. I like that light blue shadow. That's pretty. You're very good with makeup. And you have an event, right, coming up that you want to get ready for? Just ignore the woman with drawing on her face. She's thinking. You okay?
Yeah.
I don't think she wants to talk. You don't have to talk. Just because
I asked.
that little thing is driving me crazy.
No.
You okay?
No, I'll be fine.
So the most important thing is that she doesn't get a bruise.
It's gonna look good.
If you take aspirin or ibuprofen, you can stop it. But people that have a little color in their skin, like I got a black eye once to myself, to me with love. And I would say it took a day or two where it was harder to cover. But when you have darker skin, we just can cover things easier. But if you hold pressure, you can avoid it. I want a little right there. Smile for me. So I'm letting, give me a real one. Okay, I see it. So she's just a little hollow underneath. So I probably, look at me. Can you look this way? No, like move your head this way. That looks really good. Here, now look right here. Beezy, make her hold her head straight. I know you don't know. Mary, no, Beezy.
You want it straight?
Good God Almighty. That's Beezy. Hold it straight. That's better.
There you go.
Okay.
Are you watching?
Yes.
See?
It looks very different.
Uh-huh.
You see the difference?
I know, doesn't it look good?
I'm gonna wipe this off so you can see. Now look at me. Oh, that's pretty.
Mm-hmm.
So smile. Smile like I'm tickling you. So she pulls up, so I'm not putting any more right there. And my pillow right here. Maybe just a little bit right there. Doesn't take much. It just takes paying attention to where you put it. The older I get, the less I have to use. Sort of. In one spot. Looks really good.
Mm-hmm.
Really good.
You're doing great.
I just like a little bit right there too. I'm actually, there are ways to use filler as a blocker, and she hikes this up, so I'm trying to stop her from doing that. I want to block it so it doesn't jump up in the middle. So you don't want that in the mouth. If you have friends that talk funny
You want to see
because
it?
their lips look weird, there can be too much filler or the wrong filler. But you can use it just a little bit to block that so that you don't keep doing that. Can't wait to do that one. See how pretty? You have to kind of get away. See? Doesn't that
Yeah,
help?
I see the difference.
Oh, wow.
Yeah.
That's really good.
I know, it looks great.
Yes.
Yes.
I
can see it. Ice over there. Okay. So we're doing, so look at, just come back this way. Now she is cocking her head that way, which is right for pictures. because this is the higher eye, so it would actually reverse if she took a picture. Will you make her do my version of her head straight? Good.
Wait, you want it which way?
Wow. It must be the drawing. It's affecting her.
Is that right?
No, move
Yes,
her.
I'm using one at
There
each.
you go. You know better.
Y'all send BZ some hearts. Really, BZ,
It's
you're
hard to tell from
serious.
this angle.
Oh my
Okay.
God. So please send her some
Right
hearts.
now. There you go. That's right.
No?
Okay. Okay, that's fine. I'm gonna move the camera. Y'all just both stay right where you are. I'm sorry, y'all, but it was just impossible. Okay, now move that for a second. So really, that's just flat out amazing. This side is a lot lighter looking, and I've still got to work over here. I haven't done that yet. Do you see how she's hiking up this brow over here? But she can't do it so much over here, and I just blocked that a little bit with the filler. So you can use it to block motion in a good way. I can't wait to do that one. I'm gonna put a little bit more. I mean, that's just beautiful. Like it takes your natural beauty and just makes it prettier, especially when you look straight. That's great. Can you want to come see from here? She's got a friend who's gonna come look. In theory, if somebody takes the ice. You see how pretty that is?
Yes,
And watch
it
when
is.
I make her head straight.
It's pretty good. See, strong little neck.
Sorry.
All
Yeah,
right.
people are very serious about their tilt. That's perfect. Now don't move, because I'm gonna move. Okay. Sorry. I know. I'm very picky. But that, it just lets you see it. That's beautiful. Yay.
Yeah, she looks different.
See?
Yeah.
Isn't that pretty?
Oh, yes. Okay.
Yeah, that looks
Mhm.
great.
The eagle.
That's nice. You okay?
Mhm.
You see the difference in you from side to side? And sometimes you look for vessels. Smile. Okay, really? Don't smile. And yeah, I mean, I hope everybody can appreciate how much that moves. She's a little hollow right here. Sometimes you just gotta take the direct path. I'm watching where I am too. If you hold pressure, you don't get a bruise. I've got this one. He is going to settle down. Strong little sucker. Okay. Hold that for me for just a second. Okay. Now just look at my hand. See the camera? Precious, we can't see if you look at here. Can you tilt your head? There. Aha, stop. Perfect. Oh, oops. Okay. Come. No, it won't let me zoom.
And so close.
Okay, so I still need a little bit more on that side. It's like this side comes out a little bit further right through there. So I'm first going to know the anatomy because that's the most important thing. I have one drop. I just need your shape to need. Oh, that's much better. So now I just see on right there, I need a little bit. So this eye, this eye is a little bit higher on this side. That brow is, I'm gonna get it in a minute, but I need a little bit more right there. Sometimes if you stick a lot, the needles can get a little dull, but if you don't, if you try to do it in less sticks, this can bruise, but I'm pulling this down so I can see this vein. That's where I need it. That's really good. You know what?
I love it.
I just need that. There you go.
Volbella.
So now I'm messing with the brows. Squeeze me. You okay? So we're gonna take some good after pictures and we'll put them together. That looks really good. Makes me happy. Now look at me. The way you move your head is perfect for pictures. She doesn't flinch at all. Is this totally numb? What would you say to that? Does it hurt you?
No, nothing. And I like it.
Good.
Thank you.
You're welcome. How does it make you feel when you look in the mirror now?
Very good. I'm looking very good.
Do you feel like you don't look like yourself?
Yeah.
Or you feel like you still look like yourself?
It's a better version.
Better version. Here's my better version. Easy, and I had some fun. Do you like having your face drawn on?
Yeah. I mean, if I
It's
get
gonna get worse.
if I get the injections after.
You will.